Welcome back. In your morning medical news, measles cases have now surged past 1,000 in this country this year, with Texas hit the hardest. State health departments there reporting most infections stem from one large multi-state outbreak. Texas leads with at least 869 cases. Minnesota has had 2. Wisconsin remaining measles-free so far. At least 128 patients have been hospitalized. Experts warn actual numbers are likely much higher because many cases go unreported. Changes are on the way, meantime, for COVID vaccines. The Food and Drug Administration adjusting the standard of evidence needed for shots to be approved for the general public. The agency says COVID boosters are expected to be available this fall for the elderly population and people with health issues that make them more susceptible to infections. But the FDA says it needs to see enough positive data from placebo-based trials before recommending COVID booster shots for people in other groups. And how you talk to your kids about emotions shapes their lifelong mental health. Experts say parents have enormous influence on their children's psychological well-being. Mandy Gaither shows us some simple conversations that can set your kids up for emotional success.
You take care of their physical health, and experts say it's just as important for parents to help children develop good mental health.
It's natural for us to not bring things up until it's top of mind or until it's a problem. The issue with that is that kids are looking to us. They need a guide.
Licensed therapist Jody Baumstein with Children's Healthcare of Atlanta says when parents talk about mental health, be open and honest. If it's never talked about, that's sending a message that it's off limits. Instead, she says to create a comfortable space where kids can ask questions, talk about feelings, and grow into adults who do that. She says to normalize these conversations.
Validate their questions, their curiosity, their confusion, whatever feelings they have, validating that experience. That's what creates a sense of safety.
Baumstein says it's also important to use age-appropriate language that's clear and concise so that it doesn't feel like it's over their head. She says to also check for clarity, making sure a child understands. Finally, Baumstein says to encourage them to not only ask for help, but to receive it. And she says a good way to do that is by modeling it yourself.
Show them that it's okay to talk to a friend, lean on someone for support. It's also okay to get help from a licensed professional.
And she also says it's important to have conversations about mental health before a problem arises so that children are prepared to handle what comes their way. She says focusing on mental health when they're young will help them make it a priority as they grow up.